Thanks for having me out here. I wish it would have been a week later, then I could have stayed and skied, but the hills aren't opening quite soon enough for me. What I'm going to be talking about is not something that's super sexy. It's not something that you're going to have a great war story to go back or this great technique to use at trial, but it is probably as important or more important than some of the trial stuff, because as most of you know, most cases settle, most cases don't go to trial. So if we can get the numbers up on those cases, that's going to help us out. So I was not doing anything in reference to Colossus 10 years ago. Back in 2002, there was a 2002 there was a seminar. Then it was Kentucky Academy of Trial Attorneys. We're one of those groups that went to the Justice Association. I like the fact that you all are still trial attorneys and advertise it that way. I wish we did. But and I heard most of the stuff I'm going to be talking to you about today, and I went back to my office and did what many of us do after a seminar. I just forgot all about it and didn't do anything with it. And then about 5 years later, I brought Jim Mathis, who is a former executive insurance adjuster for State Farm and Allstate. He helped develop the logarithms and the parameters on the Colossus program and the TEACH program for State Farm, and he was fired and let go, but they didn't have a non-compete with him, which was a fatal error on their part. So he's out preaching, what Colossus is and what you can do to maximize your settlements in reference to it. So 80% of what I'm talking to you about I've learned from Jim Mathis, and I would his website's referenced in my material, sequoiavisions.com, and he has a great program that mimics Colossus that at my office we've modified it about 80%, but it's a great tool if you do any number of car wreck cases. So I want to run a fact scenario by you, but first, how many people have even heard of Colossus? Okay, most people. How many people believe in it? That's kind of the problem. I talked to somebody last night that asked, are insurance companies still using Colossus? Well, Colossus, we're using that as a generic term. That is Allstate's version of it, but there's a lot of other companies out there, and they all have some version of it. There's SMART, there's TEACH, there's all kinds of different acronyms for it, but they were all developed by the McKinsey Corporation years ago, and they've just brought it in their and they've set their own logarithms and parameters. And over 90% of the insurance companies in the United States right now are using some version of that. The only one that I deal with back in Kentucky that does not use a program that goes old school, so to speak, is Progressive Insurance Company. But all the other major ones that I'm aware of do use that. Now, if you had somebody come into your office, say they had been in a rear-end collision, say 6 months ago, there's about $1,200 to $1,400 of property damage done on the car. They didn't get any treatment for a week. Pain didn't go away in their neck and back, and then they went to a chiropractor. Chiropractor had run up about $14,000 worth of bills. How many in this room would be excited to get that case and would want as many of those as they could possibly get? Just one Supreme Court justice raised his hand. I had to get you back for that Iowa shirt. So, but those are the type of cases we're talking about. what would that case settle for in Montana? I mean, in Kentucky, I'm going to get depending on the insurance company, $3,000 to $5,000 offer on something like that. Is that in the ballpark for you all on that type of case? Somewhere? So what I did on that case, when Lisa came into my office, we sent her out for an independent medical exam by one of the doctors. We sent her for a motion x-ray, and because she was still having problems. And on the independent medical exam, they found ligament damage in her neck and gave her a 25-28% disability rating on some of the techniques I'm going to talk to you about. As soon as we sent that information to the insurance company, they gave us the $25,000 policy limits. That's all that was on this one. We had to file suit on the underinsured claim after we took the deposition of their expert doctor, who during the course of that admitted that he had never even read the AMA guidelines in reference to the section that he was supposed to be an expert on. They tendered their limits of $25,000. So these techniques will work if you use them. It is not this special arrow that you're going to be able to pull out and use on every case. It is not easy. It can be time consuming, but you can take the value of your cases and double them. You can't, it's not going to make a crappy case a good case. I mean, there's going to have to be injuries, but it will help out unless you're dealing with Liberty Mutual right now. Liberty Mutual, they're making, their offers are just horrendous. We don't even send a settlement brochure on Liberty at this point. We just go straight to court on them. So I think it's good to have, it looks like I'm stuck too. There we go. So I want to give you a little history on what's going on with Colossus. As I said, there's numerous programs out there, and all these programs are similar in the fact that there's over 10,000 value drivers that are put in place for this. What a value driver is, it's something that drives the value of your claim, obviously, but there are things like injury codes and any supportive information like an emergency room trip, whether a TENS unit was prescribed, whether they went to a chiropractor or a medical doctor, those sort of things. Then there's severity codes, which are number of treatments, value, type of treatment, that sort of thing that go into it. And we have numerous programs, and this was all developed by one data company in Australia called McKinsey Corporation back many years ago. So we have them to thank for this. Oops. I got a sticky finger. So when I first started practicing, I was, after I left insurance defense work, which I did not enjoy at all, I was doing criminal defense work mainly. And then I would get a few car wreck cases, and I was kind of on the end of what I kind of refer to as the golden age of personal injury work, at least in Kentucky. First one I get, I got 10,000 medical bills, and I settled for $40,000. And then all of a sudden, things started to change, and the computer programs came into effect, and instead of the adjuster's experience, it's what is put into this program. So if you're sending a basic old school settlement brochure thinking you're talking to the adjuster, you're not. You need to talk to the computer program in your settlement brochure. And I'm not sure if I sent a copy or an example demand package in with my materials. If I didn't, and you email me, I'll send you an example that I send out. But you need to remember who your audience is. I mean, it's kind of a basic speech thing, but in this case, it's not a jury, it's not an insurance adjuster, it's a computer program, and the claims adjuster is someone who is basically a data entry clerk. And it is really kind of mind-boggling. When I first got into looking at all this stuff, these are some of the names of the different programs that are out there right now. The ones on the bottom, there's actually another series of programs that deal just with medical bills and how they're going to chop the medical bills to the providers. So what is Colossus? It's a computer program that rates it. What's used in Montana is going to be totally different as far as the variables that are used in Kentucky. What happens is senior insurance claim adjuster for Allstate is going to look at the county that you're in. They're going to look at the type of trials, the type of settlements that are out there, and the what the juries are like and that sort of thing. So they might put a value range on a net case here of 10,000. It might be 5,000 in Kentucky. It's not going to be uniform. The way they come to those figures is going to be uniform, but not the figures themselves. So it is based on what the local companies do. This is kind of crazy. I probably need to update this slide a little bit, but you can see 1990, you could buy a new car, and then in 17 years it basically, tripled in value. Claims used to sell for 4 to 5 times the specials, and now the average claim is $6,000 to $10,000. And I think that figure has gone down. Those are figures from the insurance association. So they're not my figures. We don't have access to what the settlements are in that. That's one thing I always thought would be valuable is if as plaintiff's attorney and with the trial lawyers, if we would share that information and what the different insurance companies were settling cases for in the state. I think that'd be a great database. But we can't think of things in the same way because of this. So, and the reason they're doing this is big money. I mean, I have a 3-story office building in an old Victorian back in Louisville, and that has my name on it. But PNC Bank or Trans-American Life Insurance, they have the big 45-story skyscraper. They have the bucks, we don't, and that's because in cutting these claims amounts using these computer programs, they're saving on the 15,000 claims that are reported each day, just conservatively $150 million a day because we're rolling over and taking lowball offers and settlements for our clients. This is a video, and you have to change the way you think about the quote whiplash case, okay? I mean, most people hear the term whiplash and they think, okay, this is a minor injury. These injuries have lifelong implications, and 40 to 50% of them are going to have what's called ligament laxity or alteration of motion segment integrity in reference to damaged ligaments in the neck. Just like if your ACL or MCL was tore, you'd have surgery on that and repair it. Unfortunately, the ligaments in the neck are the same thing, but they're much smaller and you can't have anything other than a fusion. And actually, we'll get into this in a little bit, but the AMA guidelines state that the proper treatment for if there's a displacement of 3.5 millimeters, that it's fusion is the proper way to fix that, which is just crazy when you think about it. So I'm going to play this video, dash cam, which is just coming in. I wish there was more of it. If anybody does not like colorful expletives, cover their ears, okay? Because there's going to be a few of them muttered in this one. It should load. You got Wi-Fi?
Yep.
Well,
There we go.
So watch the right in the rear view mirror and you'll see a car coming up on them.
What the fuck?
That keeps hit me so fucking hard, I'm doing it.
So y'all kind of get the idea. These are, these are not all minor accidents. I think, I'm trying to remember who I spoke to last night that had one of these. We can go ahead and turn it off. He's going to get out and get back in, lay down. But that's, these aren't minimal. You can tell by the way that neck jerked, something happened there, okay? This one is, we haven't litigated this one yet, but it's the best example I have of showing this. Who did I speak with last night that had one of these actually that destroyed their case, I think? Yeah, okay. Yeah, that was, if it shows no movement, I mean, that's a bad thing, but I wish I could have that on every case. That would be like the greatest thing in the world. So these are major cases, and at this point in time, what we have is insurance company. They've gone all profit. They're not looking at their insured any longer. They're not looking at doing the right thing. They've gone through their investments, increasing policy numbers and all that to increase profits, and now it's coming from the insurance claims department. By lowering those payouts, they've been able to increase the profit quite a bit. And you've probably seen this. If there is any defense whatsoever, you're going to get a lowball offer. And every once in a while, you'll get a limits offer, and you'll think, oh man, Allstate's not that bad. But they know at that point in time that they're not going to be able to defend that case, and they're going to stay. And the reason they're doing this is that figure right down there, that 5%. That's all an office can litigate, and then if you say how many cases can you try in a year, it's less than the 5%. So they know that we cannot force the issue on every case, so we have to give them a reason why. This is an interesting statistic, and this comes once again from insurance documents. 20% of the public injury in a car accident retain an attorney. That means 80% go forward without our help, which is just mind-boggling to me. And of those, most of them are going to settle for whatever the insurance company offers. So, I guess that's a huge marketing strategy if you can figure out how to get that 80% to actually call in. The other thing that the computer program does, if the claim doesn't go well, as long as they follow procedures, the adjuster follows procedures, they don't get dinged. The only way they can get a black mark in their file is if they do not follow the company procedures that are set up. And I've this information comes from, like I said, Jim Mathis, who is just a brilliant, he's a great bad faith expert that we've used in that. But I've also had a chance to talk to several former claims adjusters, and I actually hired someone that used to do this type of work for Allstate and Grange Insurance Company in my office as a case manager, and she verified everything that we were talking about. I chaired one of these seminars back in Louisville a couple years ago, and brought Patty in with me, and we just did a question and answer session for an hour. Just, everything you want to ask an insurance adjuster and get a candid answer. It wasn't taped, so we wanted to make sure that everything, was going to be candid and there wasn't going to be any way compromised. think we've talked about all this, but basically, you know, the adjuster has no responsibility, and because of that, they have no ownership. They're going to deny, not pay. They're not responsible, and they're just, you know, it's just like take it or leave it. Screw you. You know, I don't care, because they don't have to get it off their table, and we're frustrated, and then they ship it off to their defense firm, and they take care of it. So, and it's dead to them. The only way they see it again is when the jury comes back. So, this is what Colossus focuses on if you're going to do a demand brochure that is geared toward Colossus. The injuries are the ICD-10 or ICD-9 if it's a little bit older, and the type. It's not, if there's not an ICD-10 or 9 code, it's not an injury as far as the computer program is concerned, with a few exceptions like scarring. The treatment modalities and cost. Any symptoms are different than injury. The physician type is important, whether it's a specialist, an MD, or a DC. That makes a difference with Colossus. They look at future treatment. They look at each body part, whether it's at static MMI, so you know there's still problems, but the treatment wasn't doing anything. And impairment's really the granddaddy of them all. If you're not getting an impairment rating, you're leaving 75% of the Colossus program and the money on the table. You don't even have a chance for it if you don't have an impairment rating on a case. And that brings out, impairment allows duties under duress and loss of enjoyment as part of the process, kind of what a lot of doctors list as activities of daily living, but broken up into 2 separate categories. Have anybody here ever had their clients magically at 100% total maximum medical improvement, just like that? You know, have 6 injuries, and all of a sudden, all of them are as good as they're going to be. You know, we're a PIP state, so the PIP money's run out and they release them. That's a red flag to Colossus. Your doctors need to be, you know, the neck is at MMI on this date, the wrist injury was an MMI on another date. You have to look at that, and your doctors need to be aware. So all this comes down to education. You have to educate not only your clients to tell your doctors what their problems are, but you need to educate your doctors to speak Colossus, or whatever you would want to call it. So Colossus, to put a value on it, kind of simply, you have an injury code. That's the value driver and the multiplier, which is usually the number of treatments. And each injury is a separate value for Colossus, okay? So if you have a doctor on the old HCFA forms, there's only 4 spots, so doctors would only put 4 injuries down. That means that's all you got credit for. It's a little bit better under the new CM 1500. There's 10 spots, but Jim Mathis says that the average rear-end motor vehicle wreck, there's going to be 12 different injuries in reference to that person that's happened. So you have injury, 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 and they keep going as many as you have. Then you add the medical expenses, the income loss, any future costs, any other considerations like scarring. That'll give the number of points, and based on the number of points, there's assigned weight as far as money value. That's how we get a number of, you know, 4,000 or 3,000 or 50,000, whatever it might be. So this is just another way of looking at it, but same thing I just said. And, you know, there's been a lot of different things been tried to get these cases settled over the years. You know, there's been, settlement sites and all that sort of thing, but those are things to ignore. So what's happened since this has been in place for the insurance companies? Basically, they've saved a hell of a lot of money in reference to what they used to pay out. So they're recapturing the profit. Their deal went, they're going to figure out a way, instead of to pay the claim, to figure out a way to deny the claim. And I think, was it Shaw that wrote the book, Delay, Deny, Defend, which is a great book if y'all haven't read that one. Other thing, and this was surprising to me, and my case manager confirmed this as well as other. Most companies only train adjusters to do their job 1 to 2 days. So if you're sending a settlement brochure up with just a stack of medical records saying, there's a wreck on this day, it was your insured's fault, and here are the medical records, medical bills were $10,000, give me some money, sort of letter, you're counting on somebody with a day, maybe 2 days training the insurance company way to fill out this program, enter this information into the program, and give your client a fair shake. It's not going to work. They're already overworked. They have, a couple hundred files, 300 different claims usually, and there's just information. There's value drivers they have no idea are out there. I have no idea that are out there. There's just so many of them. So you got to change your mindset, as I said. We have to figure out what it takes to feed Colossus. You got to give the program what it wants if you're going to get a fair settlement for your client, or a better settlement. When I meet with my client the first time, I talk to him about the computer program that the insurance company is going to use and what they need to tell the doctor because of that. Because if there's things like the loss of enjoyment and duties under duress, if they're not telling their doctor that I can't pick my baby up out of the crib at night because my back hurts so bad and I have to get my husband to do it, or I have to get up every 15 minutes at work because when I'm leaning over a computer screen I just can't take it, the pain gets too severe. If they're not saying those sort of things to the medical provider is not getting them into the record, and if they're not in the record, it doesn't count. It's not like a jury trial where they can believe your client or not believe your client. The computer program only is entered if it is in the medical records. You pull it out of the medical records and put it in your settlement brochure. Those two things don't happen, it's not going to end up being part of the program and part of the value of your case. It's just, you have to figure out what the variables are. Just like the case that I was telling you about at the beginning, if I wouldn't have picked up on the fact that my client was still having some numbness and radiating pain, I wouldn't I wouldn't have sent her out for the additional testing for the IME, and she would have been looking at a $3,000, $4,000, $5,000, $6,000 settlement probably. You need to look for these things because the doctors aren't always they're not always looking for that. I mean, in Kentucky we have a battle all the time because with the PIP you have $10,000 as soon as a car wreck case comes in. If it's a medical clinic or a chiropractic clinic, they think, oh, that $10,000 is mine. I've got to bill it out, and they churn and burn it in 4 to 6 weeks, and then the client doesn't have any way of getting treatment. So you need to be on alert for that sort of thing. The other thing is, I actually talk to the doctors. We have about 5 medical doctors that we refer to now that I'll do independent medical exams, and there's a lot of chiropractic cases which I used to think were god awful, but actually they can be really, really good cases if you handle them right. But we go out anytime we have a doctor we haven't dealt with before. I'll go out and talk to them at lunch, and bring up all this stuff. Or I've got a bourbon and cigar room in the back of my office. I'll invite them over, and we'll do it that way, which is always preferable for me. Once again, the coding has to be there. If it's not there, I mean, you can have it sent out for a code evaluation. Then you would have to have the doctor sign off and say, yeah, this is all appropriate coding. That's really easier said than done. It's not, most doctors don't want to think they've missed something. You need to, make sure all injuries are listed. This is the old series. These were the most common of the injury codes you'd see. The 728.4 is ligament laxity, and I think it's M24.20 under the ICD-10. But those are the ones you're going to see, but they're all, any coding is acceptable if it's a complaint from the car wreck. We've already talked about that. The one thing, neck pain, if you have neck pain radiating down to the lower back, you all probably seen that diagnosis. You need to talk to your doctor. They can have neck pain, they can have radiating pain, but then they also have to have back pain. You're leaving an injury code on the table by them not catching, or by the way they actually code it. This doesn't go so much to the treatment that the doctor's giving. It is the way that you have to talk to Colossus, and that's the thing that you have to tell them. Each injury, depending on how it's coded, there's going to be a drop-down menu that it starts asking questions, and that's what triggers the adjuster and what you have to tell them about the input, making sure the adjuster does it. When you all get a copy of my settlement package letter that we send out, it's almost like a spreadsheet as opposed to a letter. It's just graphs and charts. So these are the different injuries that can be used in Colossus. Just basically anything that happens in a car wreck case. Each body part, each injury, other than the neck and back, I think it's ironic that a lot of the computer programs will cut chiropractic treatment at 12 weeks or so, but they don't require a stabilization period. But each body part has to have some sort of stabilization period within these parameters. And if it's not one of those, then Colossus doesn't look at it, so it has to be worded correctly. The neck and the back and all injuries require, when you're given a Colossus, the last treatment date and then the number of visits that were for that particular body part. So, the neck could be treated 40 times and the lower back could be treated 30 times. They're not all going to be the same, and those are things that you have to go through and pull up if your doctors aren't giving you a report that's Colossus friendly. Every body part, every injury has to have a prognosis. There is an error on this slide though. The most valuable is not E, it is D. D has the highest value. Complaints with treatment recommended. That's going to get you more value. A chiropractor cannot give that though. So if you have a chiropractic only case and somebody has a permanent injury, you're not going to get any future treatment costs. You're not going to get any anything as far as past the 12 or 20 visits that the insurance company does, unless you have what's called an MD validation or an IME. I like using an IME. We have several doctors we send our clients to if they go to a chiropractor. It's usually about $850, and they do a test on them, and then they'll give an impairment rating based on what the injuries are. And that way you have a built-in expert if the case does go to court. My understanding is a paper review is just as good, so you can mail the records to a doctor and they can do the same thing without seeing them. But I like going the extra step, because if I'm going to have it, I want to have it in the bank for a jury trial if need be. So we have future treatment costs. We need to get, with the impairment rating, we'll get into duties under duress and loss of enjoyment. These are the different symptoms that are recognized from Colossus. A couple of them, anxiety and depression, TMJ, that allows additional input. So if you have those, you want to make sure that they're treated by your doctor, and it can be something pretty minimal. Jim Mathis, he says these are the only symptoms that Colossus accepts. For me, I throw in the kitchen sink. If there are any symptom whatsoever, I'm going to list it, and I think it seems to be inputted. I've seen a little bit of a rise since I've been doing that. So for the TMJ and depression, that sort of thing, the doctor has to list it, and he has to give some sort of treatment. If somebody's anxious, it might be, Doc, I'm nervous every time I drive by where the wreck happened. Well, don't drive by where the wreck happened, and that's going to get you some additional point. But it has to be documented in the records if it's going to give you any value. About any treatment is recognized through Colossus, so any type of treatment, and these can be home treatments too. So you get into things like self-exercise and home gym, that sort of thing. All that is something that can be listed under the therapies. So these are any testing is good. Used to be, up until about 5 years ago, the Mac Daddy was an MRI. If you had a herniated disc, that was fine. Now, motion X-ray has as much value if it's positive as a herniated disc under the Colossus program. They've changed the parameters. There's been some good verdicts. I know one out of Arkansas, $1 million verdict in reference to using a motion X-ray on AOMSI type case. Now, I don't know, there's a lot of states that don't have the capability to get motion X-rays, and I only use that if it's going to go to trial. In other words, I will, if it looks like we're going to have to go to court, I'll have the doctor send the patient out for a motion X-ray. A flexion extension X-ray is going to do the exact same thing. So as long as your doctor's getting a flexion and extension X-ray, they can do the calculations to determine whether or not there's any ligament damage that fit within the parameters of the AMA guidelines. This is, if we can just show this directly, I thought it'd be good to show what a motion X-ray is. This is just an example I pulled up off of YouTube, but it's a pretty cool jury trial tool if you all ever have a chance to use it, because I mean, it's kind of freaky watching a skeleton move, and knowing it's the real person when you have that person right there. You go ahead and hit play. See if this one works.
Imaging system to enable the treating physician to visualize and evaluate all body joints in motion. Dynamic motion X-ray is a patented and trademarked system utilizing a low-dose generator and a customized cutting-edge image intensifier. By utilizing new computer chip camera technology, we are able to create crystal clear motion X-ray images with less radiation than traditional static X-rays.
You go ahead, Paul.
Standard hospital for us.
So what that does is it allows the doctor to do a freeze frame and under the AMA guidelines, they can do angles, and if there's more than 3.5 milliliter gap or a slippage, it is a 25 to 28% impairment rating under the AMA guidelines. I think if you look up on the KJA website, Jack Sells did a webinar. He's pretty much the guru on this stuff in the Midwest, and you can order that, and he talks about how you spot these things, how they're used, how they're diagnosed, how the angulation and that works, and that's a little more than what I have time to get into today, but that's an hour and a half in and of itself. All right, not moving again. All right. Also, complications, if you have any complications, those are listed in your settlement brochure, so anything that happens that's a little unusual, you need to look at it. Travel costs to and from every doctor's visit, you need to put those in. It's pretty easy. Just use MapQuest. From your client's home to the doctor, multiply that by 2 because they do have to go home. Those are add-ons that get you an extra $1,000, $1,500 depending on the case usually. I'm just heavy-handed on this thing. Future treatment is another thing if you have it. The one thing, if it's a chiropractic case, you have to have that MD validation or the IME to get it done, because if not, it won't count. It can be treatment for the rest of their life. The program won't count it without some sort of validation, and it has to either be probable, listed as 51 to 75 medically certain, or definite, 76 to 100%. So if your doctor in Kentucky, the magic language is based on reasonable medical probability, if they put that in their narrative in reference to the future treatment, it's not going to be counted because you're not speaking the language that Colossus needs you to speak. So once again, these are the things that you have to look at in reference to what you need to put in your settlement brochure. And what we're going to talk to now is impairment. This is the granddaddy of them all, so to speak. There's general damages are assigned within 4 categories in Colossus. The trauma, which is pain and suffering, that's what we've been talking about up to this point in time. And then you get permanent impairment. So that's important to get that rating. And what permanent impairment does, it allows these 2 screens, to be opened up in Colossus. So your duties under duress, which is what you have to do at work to get through, and your loss of enjoyment of life, those are only things that Colossus considers if there is an impairment rating. So it has to be, I think it's 2%. It doesn't have to be like the 25 to 28. It can be something minor in order to open those screens up. So, and it's a permanent medical condition. Everybody, whatever the definition would be here in Montana, but it's going to be something similar to this. And like I said, it's one of the 2 most powerful value drivers other than the injury code. Colossus uses the 5th edition AMA guidelines for impairments. So I don't know if you all use the 6th edition or not here, but 5th edition is what your doctors would need to use, despite what the courts use, if you're going to be sending out these impairment ratings. And has to be at a static maximum medical improvement for the body part. So, they're not getting any better after the treatment stopped. They didn't get any better. You can start treatment up again, but So those are our definitions: stable, stopped receiving treatment, or static, period of time has passed when treatment has stopped and the conclusion and the condition is not improved at all. And it's the body part. Like I said before, it is each body part. It is not the whole person. The whole body doesn't automatically heal at the same time. Adjusters will only put in the impairment rating if it's an AMA-derived impairment. There's documentation, and it's permanent and stationary before making that condition. They also need to, this is one of the areas where the adjuster has some leeway. If it's a qualified physician, they'll put it in. If you're getting some, buddy that just churns and burns these things that they have no respect for, they are not going to put it in. I was having lunch one day with a former insurance adjuster that works for a buddy of mine's office, runs their settlement portion. I was asked, do y'all really, when you're an adjuster, do you really have certain doctors and attorneys that you just automatically give horrible, low offers to? Because I was just found like there's a couple medical clinics, no matter what I did, $3,000 to $5,000 was what the settlement authority was going to be. So she said, well, yeah, kind of. Which doctors are? She really didn't want to say, but I'll tell you what, how about if you just look away, I'll mention a doctor's name. And I start mentioning names of some of the ones that I knew were, not doing things the right way. And, it confirmed what I figured. And, you just need to stay away from those docs. If they're, we have all these Florida companies coming into Kentucky right now because PIP went away in Florida and Kentucky still has PIP. So we're competing against, it's crazy out there right now. It's like the Wild West as far as getting a car wreck case. We have chiropractors that are paying for patients. We have runners that get the police reports or listen to scanners and show up and knock on the door of people's houses trying to get them to go to particular providers. It's just, I even had one client say that a guy had offered them heroin to go to a particular doctor. I'm just like, that shows that you're a client for me. You didn't take take that particular bribe, but it's Wild West. I know this is the West and Kentucky's Midwest, but it's just crazy right now. Chiropractor is not recognized as a qualified doctor for an impairment rating, so get that MD validation. Once again, this is what I just talked about. The doctor and the claimant have to be credible for them to look at this. So you need it's just the body part or system impaired. It's not, and then it goes to the whole body as assigned by the medical examiner. And this is different than a disability. A permanent disability is what you can't do. Impairment rating is something a medical doctor assigns to your client. So you need the prognosis of continuing complaints and continuing treatment if you're going to get any future treatment costs in reference to this. Seems kind of academic, but you'd be surprised. And you'd be surprised also how many doctors won't put a prognosis in, the final. They'll put something like guarded or to be determined. You need to have this language if there's going to be future treatment costs. And it has to be medically documented. It can't come from you, can't come from your client. The doctor has to say. And the probability has to fall into one of those three categories that I talked to you about before. This is just an example for future medical expenses, what would need to be put by the doctor. My eyes won't read the prompter there, so y'all can read that, I'm sure, better than me. But it basically has to say, in their opinion, it's probable or definite that they're going to need treatment of $2,500 a year over the next 10 years or whatever it might be, and document what that is. This permanent impairment then gets you into the duties under duress and loss of enjoyment. Now, I'm going to kind of blow through these slides since I only have about 10 minutes left here. But loss of enjoyment of life is a permanent loss. So it is considered by Colossus, and it is considered in each one of the injury codes that I talked about before. So if you have 4 injury codes, you can put the loss of enjoyment down for each one of those injury codes. If you have 15, you can put it down for each one of those. So it's important that, that you get to those. There has to be an impairment rating. Each company, each state, county may be a little bit different. The general consensus is 2% or more is going to get you into these other screens. Loss of enjoyment, that can be anything, any hobby, sport. It can even be if you enjoy housework, you can have loss of enjoyment from that. And once again, it has to have the correct prognosis. That kind of describes my golf game right there. So, the other thing, when you're looking at the loss of enjoyment, it's going to come down to these categories. And hobbies is one that you can look at and you can really jack up, so to speak. For me, say I had loss of enjoyment. There has to be, a reason. If you enjoy what you're doing at work, that can be part of it. If you're one of those people like me that enjoy going into work and working with people, all these sort of things that are coming up here are losses that need to be documented and will be recognized under Colossus. Once again, I haven't seen one of these, but it's recognized by Colossus. So it just has to be something that, gardening, that sort of thing, once again, it has to be documented. Your client has to tell the doctor this, and it has to be in those medical records. Hobbies is kind of a different thing. So my brother plays on kind of like a minor league golf tour. So if he was in a car wreck and he was unable to play golf, it would make his level and where he was and able to get back to would make a huge difference. Whereas since I've never been competitive or anything like that, I go out for the camaraderie and just to get away and have a few beers, it would be a less value for me. So those are things you need to drill down with your clients and find out, okay, what type of, how serious were you about this hobby? Are you a 300 bowler? Do you play in leagues? Do you ever compete? So, all right, so impairment ratings aren't taken from a chiropractor. You got to have an MD, and it has to be, any impairment should be validated by a qualified doctor if you're going to get these points. Duties under duress, this is basically the work version of loss of enjoyment. And this right here is one that most people don't think to put in. If people have any sort of neck or back problem, they're going to have problems sitting and looking at a computer screen, especially if they're hunched over in an improper position. So it's one of the 4 significant value drivers, so you need to look at this. This is the type of duties you can have under duress if you have to do household duties. Pretty much similar to what we had talked about. Once again, it's That's what we talked about. Was the duty performed? Is it in the medical records? And did you make the claim for it? If those things don't happen, your client doesn't get compensated for that under Colossus. Let's see where we go. Once again, these are different things that you can get from work. You know, anxiety and depression, that's a duty under duress if it's documented by your doctors. Domestic duties, very similar. It's a difference whether or not your client is married or single. You know, if they're single, this claim's worth a lot more because they got to do it all themselves. They don't have the assistance of the spouse in dealing with the household duties. So you need to mention that in your settlement brochure if you're making these claims, whether or not you have a single individual or a married individual or a separated individual, that sort of thing. So these are the other household duties that you know, are required that can come in under duties. This can, once again, this is not only it doesn't have to be a forever sort of claim. You know, this can be, you know, up to 6 months, up to 9 months, or for 3 months. So you need to document how long this problem is ongoing. So I guess I was a step ahead of myself there. So communication. You have to ask them the questions. Delays and gaps, they're actually a good thing. This isn't a bad thing under Colossus, so don't run from it. Document it. Make sure you give them the prior records. Gary Johnson, who's an attorney in Eastern Kentucky, he calls it the reverse judo method, and you know, you just got to turn it around on them. So you just got, but you have to make sure that if there is a delay or a gap, or if there's anything pre-existing, that it's explained in the records. Okay, so if you have a gap in, you know, if you had delayed, like my example I gave you at the beginning, you know, she went a week or so without going to the doctor. Well, you need to document that she had the heating pad on the neck, was getting massages from her husband, you know, was, you know, stretching out, taking ibuprofen, all that sort of thing. So you just need to make sure that your clients explain this to the doctor and that they know. So the bottom line is you've got to pile everything in there. A lot of these things can be, you know, the medications, whether it's short-term medication, long-term medication, testing, TENS unit, all this sort of thing needs to be thrown in. If it's not in there, it doesn't count. And in some of these cases, you're talking $300 here, $600 there that are added up. But from my, you know, I used to get $3,000 to $5,000 offers on a basic case without an impairment rating. And now I'm getting $9,000 to $12,000 offers. And if I have an impairment rating, you know, that's usually the policy limits if it's a $25,000 policy. So from my estimation, it's worth it for your clients to do the extra work. These are some add-ons. Loss of income and medical bills. It's just like you would think. How much was the loss of income? How much were the total medical bills? These are the things that I put in my settlement brochure, and that kind of goes. I like putting it, I don't ask for an amount, so I'm going to just push this up. I guess I'm done, so y'all can take a break. So that's pretty much, the rest of this is pretty much a summary of what I've talked about, just kind of put in a lot of bullet points. But if anybody, I know I didn't leave any time for questions. If anybody has a question, I'm going to be around for a little while. I don't have a flight until 1:20. You can ask me. My email address and telephone number is on the materials. You can email me at mike@mikeschaferlaw.com, and I will get back with you and answer that. I'm more than glad to discuss any issues you're having with this at any point in time. And I urge you to go to sequoiavisions.com and take a look at that program. It makes it really easy once you learn to use it. And I've been using it for 15 years to enter the information, spit out the demand, make some modifications, and I'll think it more than pay for itself after the first 2 clients you use it on. But that's all I have. Thanks for having me.